Shark Family, this week on Barbell Shrugged, Dr. Justin Houman is coming on to the podcast. We're talking men's health, fertility, erectile dysfunction, all things reproductive health for males. As always, friends, make sure you get over to rapidhealthreport.com. That's where Dan Garner and Dr. Andy Galpin will be doing a free lab, lifestyle, and performance analysis. You can access that free report over at rapidhealthreport.com. Friends, let's get into the show. Welcome to Barbell Shrugged. I'm Anders Warner, Doug Larson. No Travis Mass today. I was just about to say his name. And Dr. Justin Houman. Dude, we're talking fertility today, and I have some real questions about this. Many people I know are struggling, and I feel like fertility has become this weird issue where people aren't getting pregnant easily, and I don't know why. And it seems many times, like you're a urologist, it seems like a lot of times it's I don't want to say it's anybody's fault, but it's the mechanics of the male that are actually the problem. Introduce yourself. And then let's just go right into the biggest question that humanity has right now. How do we continue?
Absolutely. So I'm Dr. Justin Houman. I'm a men's health urologist based in Beverly Hills. I'm assistant professor of urology at Cedars-Sinai, and I specialize in urology and men's sexual and reproductive health. But to answer your question about male fertility, so it takes two to tango, right? Fertility is one of those things that it takes two to tango. There's obviously the male component and then the female component. When you're looking at, not to say who's at fault, but about half the time it's male factor infertility. So things that could cause infertility from the male side, low sperm counts, abnormal sperm, what have you. But it is a growing issue. There's no question about it. We're seeing more and more cases in terms of the prevalence, in terms of the numbers of male factor infertility. And we could dive into it, but there's definitely a number of identifiable causes in the current state of things in the United States.
Yeah, I on like the male side, I'd like to actually stay on the male side of it today. Most of our audience is male. And what are some of the I've never been to the clinic, but I hear the one of I feel like I'm having sperm that have round heads and cannot penetrate the egg seems to be something that I hear from males, some of my friends, that is kind of like the cause, or maybe like the symptom of the issue. But if we were to like dig back and like in your practice, like what is the root cause of why that's happening?
So that really makes sense in terms of that is the idea. The sperm is unable to penetrate the egg because the sperm quality, the sperm DNA, the sperm morphology, the shape of it, they just they don't fit. It's like a lock and a key. The key just doesn't fit into the lock. But to break down what the causes of male factor infertility are, I like to simplify it. There's four main reasons. Number one, and probably this is the biggest one in modern society, it's lifestyle. We're eating poor diets, we're
Yeah.
sleeping less, we're more stressed out, and we're not exercising as much as we used to. All of these decrease our testosterone counts, our hormone production, and as a result of that, sperm quality is being damaged. The second thing is that we have to look at is actually hormone, testosterone production. Because of our sedentary lifestyles, we're not getting as much vitamin D. We're going from couch to, we wake up in the morning, go into our office, sit at our desk for 8 hours a day. Not getting as much vitamin D, not moving around. So that decreases our hormone production.
Yeah.
The third thing is genetic factors. Now, has been around for a long time. We don't have as many tests as we'd like to check for genetic factors, but sometimes men are dealt a particular hand in terms of not being able to produce sperm. So we get tests for that. And then the last one is anatomical things. So that's the fourth thing. And when I say anatomy, some guys are born with something called a varicocele, or they develop it throughout the course of their lives. It's varicose veins of their testicles. Now, the reason I bring this up is this is the most
We've had a
easily,
client with that. I'd never
yeah.
heard of it before, but we have a client that had that.
Yeah, so the reason I bring it up here is because there's two types of men who typically get this. Number one, tall, lanky men, tall, skinny men, and then secondly, it's bodybuilders, heavy weightlifters, because you're increasing that abdominal pressure, and it puts pressure on the veins of the scrotum, and it basically creates more blood or dilated veins in the scrotum, which it increases testicular temperature and then damage the DNA integrity of the sperm.
of all of those kind of lifestyle feels like one that is like very easy to fix in many ways. Does a lot of this come down to like obesity as kind of like the one of the larger reasons why your body is just like, hey, before we start breeding things, why don't you get your own self back down to a normal body weight so that we don't have to like pass all this stuff on to the next generation?
Definitely. I mean, the thing is, we were able to quantify some things of sperm, how they look and whatnot. But when it comes to if you're an unhealthy male, your sperm are generally
You're
going to
not
be
breedable.
unhealthy. You're not breedable. You're not doing yourself any favors, right?
Yeah.
You're really not doing yourself any favors. As you know, if you're obese, your testosterone levels, or your testosterone levels may be okay, but your estrogen levels go up, right? As a result of that, you're increasing your estrogen levels, which is obviously not good for sperm production as well, either. So.
Mhm.
Yeah, if you want to be like you got to take care of yourself if you want to have good sperm health, no question about it.
But I feel like obesity is obviously a huge issue, and those guys are going to have a million problems. But I know many people like we surround ourselves with many fairly healthy people, all things considered, and many of them have low testosterone, and many of them have trouble getting pregnant and miscarriages and the whole thing. Even if they've eaten healthy basically their entire lives, they've been in the fitness industry their whole lives, like they've lifted weights their entire lives, like they prioritize sleep and recovery, and they do quote unquote all the things right, but there's still these persistent problems, even in what I would consider to be some of like the healthiest people that I know, like the top 1%ers of health and fitness are still having issues. Like, how is that occurring independent of obesity and everything else?
Yeah, that's a great question. So, again, one thing we have to consider here is male factor infertility is only one part of it. It's only half the equation. So, the male could be the healthiest, top 1%, doing all the right things, has always been doing the right things, but his female partner, maybe a little bit on the older side, have lower egg quality. As a result of that, even if you're the healthiest person, you can't overcome some of the issues when it comes to egg quality and egg count. So that's one thing to
Mm.
consider. But the other thing is, and this is what something I've seen is there's a lot of times, or we do see it enough where a guy is just so fit, if you will, where he's doing all the right things in terms of exercise. And when you do too much exercise, that could decrease your testosterone levels as well, which could negatively impact sperm quality. So there's like this
Mm.
fine, there's this narrow range of like a sweet spot where in terms of exercise and performance, where if you're putting your body under too much duress on a daily basis, weekly basis, monthly basis, you're negatively impacting testosterone production, which again could damage or decrease sperm counts.
Hmm.
Um, yeah. Are there like environment? Yeah, go ahead, Doug. Sorry.
I was going to follow up on some of that, like regarding hormones. Like we always talk about testosterone, but testosterone in and of itself, like, isn't the thing that affects fertility. Like, how does testosterone and all the downstream effects of low testosterone actually contribute to lower sperm count and or lower sperm quality?
Yeah, so this is very important in the sense that so a guy will hear this and be like, well, if my testosterone numbers are low, I'm going to boost my testosterone and I'm going to have higher sperm counts. And they'll go to a TRT clinic and get a testosterone replacement therapy clinic, get a shot at testosterone. And the thing here, the most important thing I could say here today is by doing that, you're killing your sperm counts. Synthetic testosterone or testosterone that's not made by the body is going to decrease your sperm counts, essentially make you infertile. Um, and that's fine. There's a time and a place for that. If you're 50, 60, 70 years old, you have low testosterone, you could do that. That's fine. Because
Hmm.
you're past, most guys are past the age of fertility at that point. But if you're a guy in your 20s or 30s, we can boost. There's a way of boosting your testosterone levels naturally. And the key thing here, it's intratesticular testosterone. That's the key thing here. So the downstream effects that you're talking about is if we boost up the amount of testosterone in the testicle with certain medications, and it's easy to do, we can improve the testosterone levels in the whole body, number one, and number two, improve sperm counts.
Dr. Andy Galpin here. As a listener of the show, you've probably heard us talking about the RTA program, which we're all incredibly proud of. It's a culmination of everything Dan Garner and I have learned over more than 2 decades of working with some of the world's most elite performers, award-winning athletes, billionaires, musicians, executives, and frankly, anyone who just wanted to be at their absolute best. RTA is not a normal coaching program. It's not just macros and a workout plan. It's not physique transformation and pre and post pictures. RTA is something completely different. RTA is incredibly comprehensive and designed to uncover your unique molecular signature, find your performance anchors, and solve them permanently. You'll be working with not one person, but rather a full team of elite professionals, each with their own special expertise to maximize precision, accuracy, and effectiveness of your analysis and optimization plan. Arate isn't about treating symptoms or quick fixes. It's about unlocking your full potential and looking, feeling, and performing at your absolute best, physically and mentally, when the stakes are the highest. To learn more, visit aratelab.com. That's ARETE lab.com. Now, back to the show.
Gotcha. Well, that's like a clomiphene type conversation, or that's
Precisely,
something
exactly,
different?
exactly. Clomiphene and then HCG, Pregnol, which is the injectable version of that.
Yeah,
Yeah.
gotcha. Yeah, keep going down that road of the kind of the pharmacology there. Like how does that all work within the body to optimize sperm count?
Yeah, so clomiphene is it's a selective estrogen receptor modulator. It basically tricks the way hormone production is made in the body is the pituitary gland in the brain secretes hormones that tell the testicles to produce testosterone and produce sperm, right? Those two things. And in doing so, that's the normal synthesis of hormones and sperm in the body. Now, what happens is because of stress, as a young guy in your 20s or 30s, if you have low T because of stress, poor diet, poor sleep, poor exercise, all of those different things, what happens? The amount of the stimuli from your pituitary gland goes down. Therefore, your testicle is not producing sperm or testosterone as much as it should. Clomiphene is very unique because it tricks that gland to produce more of that trigger, those trigger hormones. It's called luteinizing hormone and follicle stimulating hormone. Those two hormones tell the testicles produce more sperm, produce more testosterone, and in doing so, it resets the cycle, the natural cycle. I call it the Clomid challenge, Clomiphene challenge. I'll put patients on it anywhere from 3 to 6 months, sometimes a little bit longer. It resets the system. Guys start exercising, sleeping right, eating right, reducing their stress, doing those things that maintain normal testosterone levels. And then we take them off the Clomid, and then they're
Mm.
able to maintain themselves at a healthy testosterone level.
Yeah, very cool. So it helps with sperm count and what have you. What about other like sexual health issues? Does it help with erectile dysfunction or anything, any other topics or
For
categories?
sure. For sure. Not the same way, and I'll say this, it's not the same way as testosterone replacement therapy for some men. Clomid, so we use Clomid off-label. It's actually a female fertility drug. We use it for men off-label for low testosterone.
Mhm.
So, I'd say about 5% of men actually have a bad reaction to this, but 95% of men, they actually respond so well. Like to your point about, increased muscle mass, brain fog, if they have brain fog, it can improve their brain fog, memory, focus, sleep, anxiety, sexual function for sure is one that Clomid could definitely help out with if you are experiencing low testosterone.
Mhm.
So all of the symptoms of low T, if you take Clomid, it could definitely help with those symptoms.
Yeah, gotcha. So, like symptom wise, even if you're like, say you haven't been trying to get somebody pregnant and you're not having challenges there yet, but you're thinking about having a kid, but you haven't really started trying yet. How do you know ahead of time that you may or may not need this until you try, or do you just need to try and it doesn't work and then you got to go get checked out, or you get labs ahead of time?
Yeah, so there's no hard and fast rule. I generally recommend, I'll tell people, so historically we've told patients, if you're struggling for 1 year to have a kid, then you should be evaluated. The male should be evaluated, the female should be evaluated. Now, in this, here in Los Angeles, for example, we have, men are getting married into their 30s, late 30s, early 40s,
Mhm.
50s, if you will, second marriages, whatnot. So these guys
Sure.
aren't being evaluated. I would generally tell guys, if you're struggling for 3 months, 6 months, get evaluated. There's at-home semen analyses. It's a semen analysis test. There's at-home blood tests that you can do. There's so many ways which you can evaluate yourself. At home, convenient, cost-effective. The earlier you do it, the better. No question about it.
Yeah.
Oh yeah, I hadn't really considered the at-home version of any of this. I kind of just assumed we have to go into some type of a office or center, but you can do this on your own at home and just send in the results.
Absolutely. There's a handful of companies now that they have these and the well-validated studies that confirm the accuracy of them, but they'll have a preservative at the bottom of the cup. Um, you essentially ejaculate into the cup, mail it in, and within a day or two, you'll have your results with, a great, with a strong accuracy associated with it.
Yeah. Um, this could just be me falling for an Instagram ad. Um, but is the clothing side, like the microplastics, a piece of this conversation, kind of environmentally? Or I always wonder anytime I see like the news article come across, I'm like, plastics, stop talking about these things. They're everywhere. But it sounds like there really are like a big issue when it comes to fertility.
So yeah, like plastics and environmental toxins and endocrine disruptors. I think those are
Yeah.
like some of the buzzwords now.
But
I
yeah,
do.
what I guess the confusion is like, is it like in the top three of things we should be worried about, or is it like in the bottom, let's get a lot of things right before we worry about switching your underwear around?
Um, so I actually think so. I do think the underwear with the they do have some endocrine disruptors in them. I do think certain ones like you kind of get what you pay for. The cheaper ones can probably create some problems down there. Um, but as a whole, so I would to answer your question, I would actually say like if you're trying to avoid being on medication or if you're trying to do these lifestyle changes at home, it's in the top three. Try to switch to cotton underwear.
Yeah.
Um, because you're not doing yourself any favors with the synthetic underwears that can cause not just endocrine disruptors, but also it increases testicular temperatures and it can
That was gonna be my next
damage.
one. Yeah.
Yeah, so it damages it in that way. Cotton is it's more breathable. It's easier for your testicles live in a much healthier environment down there. Um, but yeah,
Loincloth, Doug. That's what you have on, right?
yeah, loincloth. Yeah,
Just
I
a
go
loincloth.
commando. I go commando.
Sure. You
Yeah,
you
the
mentioned
scrubs all day, man, for sure.
That's right.
so you mentioned temperature a number of times here. To what degree is that like an acute thing where it's like just, for the hours after you were hot, say you were in a sauna or a hot tub or something like that, you have a lower ability to impregnate somebody versus like, you were in a hot environment and then like, a week later, a month later, like what's the time domain there and kind of what's the range of possibility if you can quantify it in some way?
So testosterone from the time, or excuse me, sperm from the time it's made until the time it's ready to be ejaculated, it's about 72 days. So about 2 to 3 months, we say. During that time, if it's exposed to increased temperatures, so like a 10-minute sauna once a month, or a 10-minute jacuzzi once a month, or maybe a couple times a month, it's not going to make a huge impact because you have to remember here that every time we ejaculate, there's tens of millions, if not hundreds of millions of sperm, right? And all you need is one of those sperm to reach the finish line. So along the way, during those 72 days, is there bulk of them that are getting damaged? Of course, right? So I would say it's not so much a couple times of increased temperature, that's fine, generally speaking. But if you're doing this on a daily basis, sauna every day, steam room every day, jacuzzi every day, for months on end, then you're not just lowering the counts of your sperm, but you're also probably damaging the DNA integrity. So it becomes
Mm.
much more difficult to reproduce or conceive as a result of that.
Mm. And so does that have to be something where you're experiencing an excessively high temperature as opposed to like say you're a distance runner and you go for an hour long run but it's 95 degrees out where you live, like is that type of temperature enough to cause some type of significant issue, or does it have to be sauna, hot tub, and the like?
I would say more likely sauna hot tub because look, our body 98, 99 is where that's our body temperature, typical body temperature. And the scrotum is kind of like a thermostat. It relaxes and contracts in order to keep the testicle within that very narrow temperature range that it likes to live in.
Mm.
So if unless you're sitting outdoors in 120 degrees for multiple hours in a given day,
Yeah.
it's not so much that part. It's when you're exposing yourself to the extreme temperatures of the sauna and then jacuzzis, obviously warm, excuse me, water. When you have the way water can increase our body temperature, it's way more significant than air, like it being in a sauna. So a
Mm.
jacuzzi sitting in there for long periods of time can definitely impact it.
Yeah. And then on the other side of it, is there any negative to being in ice baths and colder temperatures?
No, not that we know of. Not that we know
Mm.
of. Some people seem to support the idea that it can increase increase testosterone production because you're decreasing the amount of blood flow to the testicle and then opening it up and really stimulating the testicles. I don't know if that's true. It's probably a mild increase in testosterone, but cold doesn't negatively impact it. No. So
Gotcha.
cold plunges are safe.
Cool. So if someone comes in and they've tried Clomid and they've fixed their testosterone, etc. Hormonally, they look fine, but it's still not working. Is there like a next step in this progression? Like where do you go from there if the hormone profile doesn't seem to do the trick?
Well, in terms of seeing, like, let's say excuse me, they still have an abnormal sperm semen analysis, you mean?
Sure. Yeah. What are all the scenarios?
Yeah. So let's say you address the hormonal issues. Obviously, a physical exam is quite important to make sure they don't have a varicocele. Again, a varicocele is the easiest. It's the most common reason why a man has infertility. I'd say about 40 to 50% of the time, it's because of a varicocele. Some guys know they have a varicocele. They could just feel that bag of worms feeling, or they see it in their
Mm,
scrotum. And sometimes
mm,
they don't. They need a physical exam. So I would say the next step is a physical exam just to make sure you don't have a varicocele.
mm.
Um, and let's say we rule out everything that we can think of, right? We improve your lifestyle, your testosterone levels, your hormonally, you're in tip-top shape. You're taking the fertility vitamins, the antioxidants that can help. You don't have a varicocele. If that's the case, and this is something that I'd say about in single digits, maybe 3% of the time, 5% of the time, the guy just has low sperm counts for based on current modern 2025 medicine. We don't have an identifiable cause. We'd say it's, potentially a genetic reason. And in those scenarios, we'd recommend some form of IUI or IVF, for example, to help, really boost sperm production to the next level, or
Mhm.
help boost the conceiving process.
Right. Wait, so
Um,
is there any treatment for the varicocele?
Absolutely, absolutely. It's a relatively straightforward treatment, easily correctable. So it's a surgery. For reproductive specialists like myself, we specialize in this. It's microsurgery, small incision in the pubic hair area, and all we do is we identify those engorged veins, and we just tie them off. The surgery takes anywhere from 30 to 45 minutes.
Mm.
Um, Outpatient, and you're really back to your normal lifestyle within a few days. But it's an
Got
easy way of correcting male factor infertility. If you're experiencing male factor infertility, you should 100% be evaluated for a varicocele.
yeah.
Gotcha.
Even before kind of like the sperm side of it, have you seen numbers on like erectile dysfunction increasing? Is something that along with like the infertility numbers going up, has that also been on the rise?
Def well, 200% with ED. But I would say for somewhat of a different reason. I do think low testosterone is contributing to it, but I'd actually say pornography is the bigger reason for young
Oh, dig
guys.
in. Oh, that's only affecting, hundreds of billions of dollars in revenue a year.
Oh yeah, oh yeah. It's just the pornography these days, how accessible it is, and how extreme it is, if you will. I mean, and we have access. It's everywhere. You have your phone on you. You could access pornography anywhere. But that's the main reason, no question about it.
Wait, what what are like the mechanisms in play there that are kind of like creating erectile dysfunction? One would think that if you're watching and practicing uh erections through porn, the erection wouldn't be the problem. Is it a like why is that happening?
Um, so well, I guess the ED is happening in the context of a relationship, right? It's happening in the context of a relationship where, sure, they're able to have good, strong erections while watching pornography, but when it comes time to engage in intercourse with your partner, you're unable to do it because you're not being stimulated. At least in simple terms, mentally, you're not
Yeah.
being stimulated the same way you are when you're watching all these videos.
Mm. So it creates more of a psychological problem, or I
Precisely.
guess it really it's somewhat physical if it's just like a receptor sensitivity type thing as well. So you just require a higher physical stimulus in addition to the mental stimulus.
I actually think your original point. I would say that's psychogenic erectile dysfunction, where it's in the head. It's the reality is unable to match up or even come close to the virtual pornography that guys are experiencing.
Gotcha. So if a guy comes in and says like I just can't get it up no matter what, like a porn actual real life sex with a real human being, it doesn't matter. I just can't do it. And then that's like a purely physical thing, and that's potentially treated one way. And then if someone comes in and says, "Yeah, I can get a boner whenever I want to, whenever I choose to," but then when I'm with my partner, it just doesn't happen. That's a different
Yeah,
situation.
yeah, but along the same vein, because it's this performance anxiety, right? They'll have like, but well, actually, your previous one, they require full on, we have to look at their hormones, we have to look at blood flow to the penis, if they have chronic illnesses like diabetes, high blood pressure, high cholesterol, all these things decrease the amount of blood flow to the penis. But
Mhm.
um, the first example that you're using, that's probably more of a physiological thing where it's hormones and blood. It's not so
Mhm.
much psychogenic, but a younger guy, I could tell you, a 20 or 30-year-old guy who comes in, um, invariably it's psychogenic, and 90% of the time it's psychogenic.
Mhm.
Um, Either pornography, or number two, it's they a night of drinking, heavy boozing, unable to perform. Next time they try to do it, they remember the previous time.
Mhm.
Immediately their erection goes down. So one
Yeah,
bad erection leads to two, leads to 20. It's just this vicious cycle,
gotcha.
this downward cycle. Yeah.
I can see that they're just in their head about it after the first time. Like,
Oh,
oh no,
oh
what if it
man.
happens again? Oh no.
Yeah.
Sure.
Yeah.
It freaks me out how many like environmental factors are that we've like actually created on our own have are creating this. And globally there's a massive problem right now with replacement. Like we don't create enough babies, and everything on our phones, everything on our bodies, like the way that we eat, everything is going against our ability to create more humans. It's like a
Right.
giant issue.
Yeah. Some countries are really
Japan's like
experiencing.
negative.
Yeah, China too. Yeah, yeah, and we're gonna get there. We're gonna get there
Oh
eventually,
yeah.
but yeah, for sure, whether it's in our lifetimes or not. But then at that point, you're gonna have it's gonna find its way, right? The trends will. This can be the first time in human history, I believe, that we're gonna have we're gonna be experiencing this, but we'll figure out a response to it, in that sense, for sure.
Yeah, what do you think the
Yeah.
response is? I'd love to dig into like how do we solve the problem? I can't imagine we're going to get less free speech on the internet. That would just create like a prohibition of porn is just going to create the same problems that prohibition of alcohol or whatever it is. Like there's always going to be this stuff that is very easy for us to get. It causes lots of problems. There's endless call it like downrange effects psychologically of it as well, which leads to the physical side. I just with the speed and power of information and the tools that we have to do it, we haven't even gotten into robots yet. I don't know, those are terrifying. Like that's coming. But what do you think overcomes all of this?
You're talking about primarily from a fertility standpoint.
Yeah, like how do you reverse it and when the course of people is heading in such a not great direction of making more people.
I would say this. I would say it's very hard to intervene for anybody to intervene on this. City, state, government, national governmental officials. Like it's hard to intervene on this. People are going to
Yeah,
have babies when they want to have babies. But I think the bigger thing here is it's tied to society and economics, right? If the cost of having a kid, if the cost of living is becoming more
yeah,
greater and greater, your reproductive ability, your chances of reproducing are going to go lower and lower. So they're all tied. It's not so much, but I agree. I mean, like what we're talking about here in terms of the difficulties of fertility for men, that's true, that's real. But I do think it's tied to a bigger socioeconomic picture that it's way more complex for at least for myself to discuss.
yeah,
Yeah, I fully agree with that. It's not just people can't have kids and everybody's trying to, and we just can't seem to pull it off. Like maybe people are just choosing not to have kids for many, many reasons that go well beyond the ability to have kids.
Yeah. Yeah, and people are content with, being by themselves or whatever, not by themselves, but people are content not having kids more so now than previous generations. Like your needs as a man can be met really in many ways. For a lot of guys, they don't even want to have sex, right? Like internet pornography does it for them.
It's kind of a wild
My
thing to
face
say.
just crunched when you said that.
I know.
That
There's
was
a
the
whole
silence. If you're
we're like,
listening at
what?
home and you're like, did they
I'm
just
like, come
cut
on.
out? No, Anders' face just crunched, thinking that porn was better than actual
Yeah.
sex.
No, there's no need to choose between the two. You could do both. You
you
know,
can
or at least pick the real life one.
do. That's
All
good.
right, so yeah, we have the side of things where again, porn and the psychological issues are one thing. Like, what do you do for an individual that you see where you see that porn is obviously a problem, but that's not really your job to like be their therapist or psychiatrist or fix whatever part of their life is causing them to have potentially like an addiction issue. Like you're a medical doctor. That's not your wheelhouse. Are you able to help those people, or do you refer them out, or how do you deal with that?
So the as much as when it comes to erectile dysfunction, we're not always pointing it to one thing. This, generally speaking, it's multifactorial. So the
Sure.
physiological reasons, so like the blood flow issues, the hormone issues, nerve issues, for example, I'll take care of that. I could fix the physiological reasons. But if it is like a performance anxiety type situation, um, I'll refer them out to a sex therapist, somebody who could, spends time with them, normalizes the conversation. Let's say, performance anxiety with their partner. You could figure out ways in which to reduce the stress there. When it comes to porn addiction, that's a whole different gamut. There's sex therapists who specialize in porn addiction.
Sure.
So I do refer out the mental aspect of things. I do refer those out to sex therapists who this isn't their wheelhouse. This is what they specialize in.
And is this all done in person, or is this a virtual thing that you do as well for the entire United States or worldwide?
Yeah, so definitely I see patients throughout the United States and in international patients as well, some in China, some in India. But in overall, most of my patients are here local. Um, but yeah, I see patients throughout the world and throughout the States.
Yeah. Do you get any pushback on that? Like California, probably not as much. Like you could say you're seeing a sex therapist in California. People are like, yeah, cool, that makes sense. But other parts of the US might not be as forward thinking. Do you get any resistance to that?
Yeah, I thought I did. It's funny that you asked that because, like, I remember when I first started my practice, I'd be like, well, listen, you should probably see a sex therapist. And I was waiting for like a lot of pushback. But what I've noticed is if they've come to see me, if they've worked their way to seeing, they've broken whatever barriers or mental barriers, taboos, in order to come to a doctor to discuss their issue, the
Yeah.
next step is it's easy for them. I don't think maybe 1 in 100 will, oh, I don't want to necessarily talk to a therapist. But at that point, if they've come to me, they're willing to go the whole way.
Sure. Dude, I can see that. If it sounded like real problems and I was seeing a doctor about it, I'd be like, dude, I'll fucking do whatever you want. Tell me, I'll talk
Yeah,
to anybody.
yeah,
Just
exactly right.
point
Exactly
me in the
right.
right direction. I'll do it.
The hard part for these guys is it's that first step. It's identifying they have a problem, and then willing to go to that next step of talking to somebody about it.
Mhm.
But my job, if a guy comes in, after a couple months of this, or even a couple weeks of this, it's so much easier for me to fix. And if they come in after a couple years of experiencing this, whether it's infertility or erectile dysfunction, doesn't matter. Um,
Mhm.
I can't stress enough the importance of addressing this earlier on. It makes my job, it makes the patient's outcome obviously a lot better, but it makes my job a lot easier as well.
Mhm. Cool. So we have like fertility, erectile dysfunction. Are there any other like categories of things that you treat that are in this same wheelhouse?
Yeah, I mean, this hormones, obviously testosterone. We talked about testosterone and Clomid, or at least Clomid, what it can do.
Mhm.
Vasectomies, vasectomy reversals.
Yeah.
Yes. So vasectomies, I don't know if you guys have ever talked about vasectomies, but it's the best form of contraception for any couple, for primarily a man, obviously, but it has the highest success rates, 99.9% success rates. The way I do it, it takes anywhere from about 7 to 8 minutes in the office, pain-free,
Mhm.
no needle, no scalpel, minimally invasive, and you have great outcomes. You're recovering with some ice over the course of a couple days after the procedure, but after that, very easy way of helping your partner out who's gone through a lot for 9 months. But the most common questions I'll get about vasectomy is I could just say this: it has zero impact on your testosterone, zero impact on your sexual function. Your erections are 100% the same. This does not impact any of that. Even the volume of your ejaculate is essentially the same. The testicles are only giving 1% of to your total volume of ejaculate. So you won't even notice the difference.
Gotcha. So sperm specifically is only 1% of the total volume, is what you're saying.
Yeah, exactly right. The rest of it's just the food, the sugars, some of the alkaline fluids that allow for the passage or the livability of sperm. But sperm is only 1% of your total volume of the ejaculate.
Gotcha. So like erectile strength and or not erectile, like orgasm strength rather, like the intensity of it and all that, totally unchanged as well.
Totally unchanged. It doesn't impact a thing. It really doesn't impact a thing. The vas that tube that tube is only involved in transport of sperm. That's it. So and it has negative impact, no impact on your testicular health.
Yeah. I've often thought this, and I've never actually spoken to a professional about it, but like a part of me wishes that I would have gotten a vasectomy when I was like 16 and then just reversed it when I was 30. Is that a thing? Is that possible? Or is there if you're out of the game for that long, can you make a full recovery? You said something about a reversal a few minutes ago. To what degree is that
Yeah.
possible?
So that's funny because like someone had told me one time that like athletes should do this. Athletes should literally when they start their careers, they should just get a vasectomy and then reverse it once they retire. But
Yeah, yeah.
the highest success rates after the highest success rates for a vasectomy reversal are about 7 to 10 years after the vasectomy. Um, Once you're getting into the double digits in terms of years, your success rates are lower. It's not when I say lower, it goes I don't know 90%. If you get to 15 years, it's probably closer to like 60%. But 0 to 10 years, you're looking at like 98, 90% success rate in terms of putting the two back together and creating viable or ejaculating viable sperm. Yeah.
Mm,
But even the one thing to note here is, I have a lot of couples who do this now is the guy's had a vasectomy after his previous marriage. He has a new partner. He's like, you know what? Like, I don't want to go through the process of getting a vasectomy reversal. It takes a couple months to recover. We're just getting my new wife has eggs on frozen eggs, for example, and there's something called a sperm retrieval, which is much easier for the male.
mm.
I literally go into the testicle using a microscope, but using a very small incision in the testicle. Literally take out sperm and use that sperm to fertilize the eggs, create an embryo, and then we implant it into the female partner. But yeah,
Yeah,
that's a much more common option that's happening these days, I'll be honest.
sure. I mean, outside of having surgery on my testicles, that that sounds like a great move.
It's a small incision, but yeah.
Sure. Yeah, right. I didn't actually realize that was a thing there. What a great idea.
Yeah, because you're always producing sperm, right? Even when you have the vasectomy, you're constantly producing sperm, producing it's breaking down, producing, breaking down, back and forth.
Gotcha. So for the vasectomy, like the sperm is being produced, and then it's being just kind of pushed down the path, but then it's just the path is blocked, and so it doesn't go any further.
It doesn't go any further, and at some point, your body will or the sperm will degrade, and using those same, well, it'll degrade, and then your body will produce more back. The continuous process. Yeah.
Gotcha. Gotcha. Yo, if you've had a vasectomy, or even if you haven't, like if you like have like the majority of an orgasm, but you don't actually orgasm, and it's like you're holding it back. Like to what degree is that an issue if you've like put that block in place and you're um I don't know the right way to word this question. If you have like multiple orgasms, but you hold them back, like all that pressure is created, but you don't actually release, is that an issue? Whether you've had a vasectomy or not? Like can that
So
cause like physical problems?
you're talking about if you're trying like if you've had a vasectomy and you're just trying to ejaculate.
Like if you're having sex, maybe this is a totally different topic, but if you're having sex and you get like almost to the point of ejaculating, well, you like kind of have an orgasm, but you don't actually ejaculate,
Yeah.
and you do that multiple times, kind of just like extending the fun, so to speak. Like to what degree could that cause like an actual physical problem?
No, it doesn't. It doesn't. It doesn't cause any long-term issues, other than it could cause like some pelvic floor pain, or it could cause a little bit of congestion in like the prostate and the seminal vesicles. Those are the glands that produce the ejaculate. You could create some congestion in there. That's kind of like the idea of blue balls a little bit. Like you could get that blue ball type feeling, that pain.
Yeah.
But like long-term effect, no, zero problem.
Gotcha. Okay. Yeah, I've
Yeah.
often wondered that after I had a vasectomy, if I've had one myself, like with that having that like block in there, if like you're like putting that pressure up against the block over and over again, or even just for you having just a normal orgasm, if over time that would, um, I don't know what would happen, but if over time that would just cause an issue.
Not at all. Not at all. You know, the
Oh,
thing
good
about
enough.
the reproductive system, specifically for men, like, you have to, we've evolved, like we've gone to this time because that area is so resilient. The glands, the penis, like the prostate gland, all that, everything that's involved in reproducing, it's gone through the course of time, right? Like it's so resilient. Um, you punch it a little bit, you cause a little bit of harm. If most of the time it figures its way out, and a lot of these things don't really impact it, so it's a pretty resilient system. Um, and I'm seeing that more and more throughout the course of my career. But
Hmm.
yeah, I'm pretty impressed by how the reproductive system is very resilient in men at least.
Gotcha. I don't know. Are there any other like common misconceptions that we need to cover here that we haven't already mentioned?
Um, Yeah, other than, fertility issues are quite common in men. Like I said, about 50% of the time it's the male partner. Erectile dysfunction, if you're, 40% of men at the age of 40, 50% of the age of 50, 60% of men at the age of 60 have some form of ED. Um, the low testosterone, and after the age of 30, majority of men, their testosterone goes down. The point I'm bringing all these up, these facts is it's kind of a fact of life for many men, unless you're super active and leading a eat clean, healthy life without wearing synthetic underwear. Like all these things, all these things are very, very common. So if you are experiencing it, just see somebody because you can improve your quality of life, your sexual quality of life, your reproductive quality of life pretty easily and pretty quickly.
Yeah. Um, let's go over kind of all the what I would call the obvious stuff, for at least for listeners of this show, like regarding fitness and training and sleep and what have you. Like, do you have standards for all those categories? For like, again, you don't want to do too much, as you mentioned earlier, and obviously you don't want to do none at all or too little. Like, what's the sweet spot for sexual health, for training, sleep, supplements to take, etc.
Yeah. So four things. It's to your point about sleep, stress, exercise, and diet. But sleep, ideally, at least 7 hours. I would actually say if you get like six and a half, it's probably good. But ideally 7 hours of sleep. That's the hard one. Supplements you can take for that, like ashwagandha, is a good one because it helps. Um, we have good data in terms of it helping with sleep, but there's tons of supplements out there for sleep. But I don't want to sell any snake oil with that one. But ashwagandha is a very good one for sleep. Stress is probably the hardest one. I would say, like, I think one of the challenges of life. I actually think one. Hey, can you hear me?
Yeah,
Sorry.
you're there. Go ahead.
I think one of the challenges of life is figuring out what relieves your stress. Now, what relieves my stress is very different than the two of you. I have patients who they're 88, 90 years old, but they've smoked a cigar every night for the last 50 years. Now, if you look at that, you'd say that's pretty unhealthy, but that's what relieves his stress. That calms him down. That gives him a good night of sleep, reduces his cortisol levels, and
Mhm.
he's able to live his life because of that. So, figuring out what reduces our stress is probably one of the challenges of life. And I think once we figure that out individually, it's a huge way of increasing longevity and overall health.
Mhm.
Third thing is in terms of exercise, I generally recommend 3 days of heavy weightlifting, 2 days of cardio if possible, or at least one day of cardio.
Okay.
Um, so a mix of cardio and strength training. And then lastly, with diet, a combination of lean proteins, healthy fats, and if you're going to have carbohydrates, complex carbohydrates. Uh, Diabetes to me is worse than HIV these days. Anything we can do to decrease the amount of sugar that we take, the amount of simple sugars, can only help us in terms of sexual health, reproductive health, and most importantly, cardiac health, which is, heart attacks and strokes are very, very common in the American male these days. So that's generally the way I break it down. Try to keep it simple.
Dude, this has been super informing, man. I appreciate you
Yeah.
coming on, hanging out with us. I've had many, many questions and many thoughts about all this. Luckily, I have two kids, and I was ready to get a vasectomy on the drive home. If they had like a
Same.
McDonald's drive-through for vasectomies, I would have been waiting in that drive-through line. And lucky enough to have two little humans that are terrorizing my house all the time now. So, but I know that many, many men and families are going through this. So I appreciate coming on and talking to us.
I appreciate you guys having me on. This is good.
Yeah. Where can people find more out about kind of what you're working on or reach out to you if they wanted to work with you?
Yeah, absolutely. Anywhere you could just Google my name, Justin Houman, MD, Houman, on any of the social media platforms on my website. Happy to help in any way or happy to engage in discussion with anybody.
Love it, man. Doug Larson.
You bet. On Instagram, Douglas C. Larson. Justin, appreciate you coming on the show. Of course, my sex life's an important part of my life, and the more I know about it, the better. So it's always nice to talk to a real expert. Presumably at some point in my life, hopefully not for a long time. I'm going to need some help in this department. Hopefully it's not until I'm 60 or 70 years old, but the more I know now, the better. So appreciate you.
Thank you. Anytime. I'll help you out in any way. Happy to.
Yep.
And you got to go back to California for it too, dude. Nice and sunny out there.
Any excuse I can get to go back.
You have to go. He's your doctor.
There you go.
I'm Anders Varner at Anders Varner, and we are Barbell Shrugged, Barbell_Shrugged. And make sure you get over to rapidhealthreport.com. That's where Dan Garner and Dr. Andy Galpin are doing a free lab, lifestyle, and performance analysis. You can access that report over at rapidhealthreport.com. Friends, we'll see you guys next week.